Hi, my name is Samantha Guerra, and today I will be talking about reproductive cancers. My main focus is on ovarian cancer. What is ovarian cancer? Ovarian cancer is a cancer that begins in the female's ovaries, which produces the eggs. Ovarian cancer often goes undetected until it starts to spread within the pelvis and the abdomen. And ovarian cancer causes more deaths than any other cancer of the female reproductive system. With more than 200,000 cases being diagnosed each year worldwide, ovarian cancer is the sixth most common tumor found in women. Out of every 3 women diagnosed with ovarian cancer, 2 lives are taken from this disease. Here are some facts on ovarian cancer. It is the #1 killer of all gynecological cancers. 40% of the women with a mutation on their BRCA genes have a lifetime risk of up to 40%. There's no test for early detection. 70% of the cancers are caught in either stage 3 or stage 4. 90% of the cancers caught in stage 1 have a 90% chance of survival. 1,500 women die of ovarian cancer each year in Canada. 90% of the women die within 10 years of diagnosis, with 70% of women dying within 5 years of their diagnosis. Some symptoms of ovarian cancer include fatigue, persistent pressure or pain in the abdomen or pelvis, weight gain, frequent or urgent urination, back pain, gas, changes in bowel movements, difficulty eating or feeling full quickly, bloating or swelling of the abdomen, vaginal bleeding, or painful intercourse. Ovarian cancer is called the cancer that whispers because symptoms are often too easily dismissed. A pap smear cannot detect ovarian cancer. Ovarian cancer research benefits advances in breast cancer since many breast cancers are related to estrogen, a hormone produced by the ovaries. The reverse is not true. The cause of ovarian cancer is unknown, but there are ways to reduce your risk of ovarian cancer. These include carrying a full-term pregnancy, taking oral contraceptives, breastfeeding, maintaining a healthy lifestyle, and surgery to remove the ovaries. Symptoms. Ovarian cancer can be easily detected early if the symptoms were being reported more often. Symptoms of ovarian cancer are often dismissed and thought of as vague complaints. If ovarian cancer was detected early, women would have a 94% chance of survival. Risk factors. One factor can be our physical health. Our weight and body mass index is proposed to alter our endogenous hormone levels that could spark the growth of the tumor in our ovaries. A second factor can be even fertility drugs. Clomiphene citrate, a drug for women with an ovulatory infertility, can be a factor as well. The agent is a selective estrogen receptor modulator that increases estradiol and progesterone levels that have been hypothesized to be a risk factor to reproductive cancers. Detection. Today, more than 70% of the women with ovarian cancer are still not being diagnosed until it reaches stages 3 or 4. In the photo below, you will see the stages of the cancer. First, before ovarian cancer, you have healthy ovaries. In stage 1 of ovarian cancer, you actually have the cancer confined to one or both ovaries. In stage 2, the cancer spreads within the pelvic region. In stage 3, the cancer spreads to other body parts within the abdomen. And finally, in stage 4, the cancer spreads beyond the abdomen to other body parts. The pelvic exam doesn't have the ability to feel the ovaries or any cancers on them. Even more so when women reach menopause, their ovaries actually shrink and become a little bit harder to feel. There are other ways to detect ovarian cancer. There is the transvaginal ultrasound. This transvaginal ultrasound can get a detailed image of the ovaries to clearly see any cancerous tumors invading them. The ultrasound is done by the doctor inserting a probe in the vagina, and if there is a mass, the ultrasound will pick it up. Unfortunately, it isn't used as often as a mammogram is used. Unless it's approved for routine, insurance companies actually won't pay for the procedure, and many doctors don't suggest it for screening purposes. Other ways to detect ovarian cancer are better blood tests. Better blood tests can also be beneficial for early detection of ovarian cancers. There is a blood test called the CA-125, which is already being used to see if women are responding to chemotherapy or to also see if the cancer has come back. Using both the transvaginal ultrasound and blood test can produce better results in the research. Using the blood test normally to keep track of any abnormalities leads to the use of the ultrasound in case the woman gets in the high risk range. In the image below, you will see the late diagnosis results in poor survival. If diagnosed at the localized stage, the 5-year survival rate is 93%. However, only 15% of all cases are being diagnosed at this stage. Treatment. The main treatments for ovarian cancer are surgery, which removes the actual tumors out of the body, chemotherapy, which is a drug that kills cancer cells but can also damage normal cells. Some side effects include nausea and vomiting, loss of appetite, loss of hair, hand and foot rashes, and even mouth sores. Then there is hormone therapy. This is the use of hormones or hormone-blocking drugs to fight off cancer. This is more often used to treat ovarian stromal tumors. There's also targeted therapy, which is a type of cancer treatment that uses drugs or other substances to find and attack cancer cells with little damage to the normal cells. Lastly, there is radiation therapy, which uses high-energy X-rays or particles to kill cancer cells. Some side effects include skin changes, fatigue, nausea and vomiting, and even diarrhea. Lastly, there is prevention. Factors linked to a lower risk of ovarian cancer include pregnancy, breastfeeding, birth control pills, having your tubes tied, and the removal of the uterus without removing the ovaries, which is called a hysterectomy, and even a low-fat diet. Thank you for watching my presentation. Here are some of the sources. Unfortunately, my iMovie application didn't grab all of them, and this is all my sources. And on this page, you will see the links for all the photos I used in this presentation. And thank you for watching my presentation.